afternoon and welcome to another episode of Healing Our Communities. I'm your host, Heather McDaniel, Vice President of the West Virginia Drug Intervention Institute. And today I have a special guest with us that I've known for quite a long time now, Tina Ramirez. Tina is the Director of the Great Rivers Regional System for Addiction Care under the Division of Addiction Services in the Department of Family and Community Health at Marshall University, Joan C. Edwards School of Medicine. Tina also serves as an officer for Kanawha Communities That Care Coalition, and we'll be talking to her today about both of those roles, the work that they do, and her involvement in both of those organizations. So welcome, Tina, to Healing Our Communities. We're excited to have you.
Thank you for having me. It's a pleasure to be here today.
Absolutely. We're so excited to talk about the work you do, your role at Great Rivers and the Coalition, and all of the services they provide. I think a lot of people don't even know what the Coalition is or what they can do. So let's let our viewers get to know a little bit more about you and your role at both Great Rivers and the Coalition. So before we get into the work you do, can you share with our viewers just a little bit about you outside of the work you do, just your background and kind of who Tina is?
Yes, for sure. So I married my high school sweetheart 29 years ago. It's hard to believe that. So we have 2 sons and 2 grandkids, a granddaughter and a grandson. We were just talking earlier about how much fun that new role that we've taken on. So we love to be on the lake or the beach throughout the whole year, and it's really cool to be able to go throughout West Virginia and see what the different coalitions have going on and be able to connect with the different communities. So that's what I enjoy doing.
Great, great. So you are the Director of Great Rivers, and for people that may not know about Great Rivers, can you tell us about Great Rivers and the general work they do and kind of how it got started, because it is a newer organization compared to some others that are out there?
Yes, so Great Rivers falls under Joan C. Edwards School of Medicine, like you mentioned earlier, Marshall Health. So initially started 6 years ago, which I can't believe it's been 6 years. But our focus back then was a grant through the Merck Foundation to really talk about 4 major counties, Kanawha, Putnam, Cabell, and Jackson. They realized early on that that was the gateway that we were seeing the biggest impact of substance use disorder throughout this area. So they came together, and I get the pleasure of working on everything for the entire continuum, which we hear that all the time, but pretty much summarizes prevention, intervention, treatment, and recovery. So really we do a lot of different things, but we work with the coalitions like we're going to talk today. We work with quick response teams out there for those who respond to overdoses. We work with the hospital systems. We work with ProAct in Huntington, which is a one-stop shop for anyone needing substance use disorder. But it's really blossomed in that 6 years. So now we are expanding, and I help manage Mason and Wayne counties as well. But really I get the pleasure to work with the entire state. So the biggest focus we have, I would say, is Charleston South, but we have partners throughout the state that we work with.
And just from being on the calls with Great Rivers, just how much those calls have grown to when there wasn't a lot of people, and now there's times you'll get on there and it's like you just keep scrolling. There's so many people attending, which is great. And always on those calls I learned something I didn't know about what's going on in the state. So I think it's been a great way to connect people and share resources as well. And now a little bit about the Coalition. So Kanawha Communities That Care, what's the Coalition about? What's their focus?
So there are prevention coalitions in every county, so 55 different coalitions throughout the state. Kanawha Communities That Care is a Kanawha County coalition under Prestera, which is Region 5, so there's 10 counties in that region. Kanawha Communities That Care has been around since 2000, which is hard to believe.
That is hard to believe.
And they're housed now under the West Virginia Drug Intervention Institute. So really they work primarily in the school systems and with community partners, you know, all the way from kindergarten to high schoolers, to focus on things, healthy alternatives to prevent them, folks from getting into, you know, addiction. They also do mental health outreach, and, you know, it also includes educating the staff, stigma training. Narcan is a big thing that I know you talk about often on this show, and medication disposable kits, all these evidence-based programs they can offer throughout the community. So it really helps bring partners together. With the coalitions throughout the state and Kanawha communities that care, we really are rebuilding. I feel like after COVID, a lot of people are rebuilding. So we try to meet monthly and get as many partners as we can together, but we're still working on rebuilding that coalition. They do a lot of great things. They also have medication disposable boxes throughout the county, so people don't have to wait for that 2 times a year when they do drug take back day. So they do a lot to help keep stuff off the streets and also educate parents and community members just what we can do to help, because we don't know. The
Right.
kids are so much smarter than us. So
Yes.
it's just staying one step ahead of those kids and providing outreach. What we're facing a lot now is vaping. So we see a lot of that throughout communities. We even had some issues in other parts of the state where kindergartners were vaping.
Oh,
so you
my.
don't think of it being that young
No.
of an issue. But yeah, so just education and connecting community people to make sure that we do the best we can for the parents and the kids in this area.
And I think the sharing of knowledge is huge, because as the parent of a middle schooler, stuff changes every single day. And for instance, yesterday on a call that you and I were on together, there was a new basically drug name that I had never heard of. No one in my office had, and that's why I sent you that text. And you were able to send me resources, because that's something now new. It's literally changing. It seems like every single day
Yes.
there's something new. And so those groups really help get that information out there. So if someone came to you and they were just interested in getting into this type of work, either with like what the coalition does or what Great River does, what would you tell them to do? What would be your advice for them on how to get started in that work?
I think the biggest thing is really start following these groups, whether they're on Facebook or their websites. So we all have really robust information that's coming in. I really like being that librarian. I don't provide direct service, but like you said, I get calls all day about different things, and I'm like, I don't know how to do that, but this person does.
Yeah.
So that's where I usually try to push out all the information, is through our Facebook, and our website has some information on there. Same way with the coalition, we try to share everything that comes across our desk. The biggest thing is we have the pleasure of being there in person at all these meetings, but even like you said, our people that we work with every day, something new will come up in this county and we're like, oh, we better pass it on to Kanawha, County, because it's going to hit there. I think we have the really great system in place with our Office of Drug Control Policy, because they will start shooting out, these alerts, hey, this type of drug is in this area 2 hours away, it's going to be hitting us by tomorrow morning. So I enjoy being able to push that information out and talk to the different people. I think the good thing about Great Rivers, and we talk about silos all the time, even within the coalitions and the community partners, I may be doing something and I've gone to a meeting and I'm like, Heather's doing the same exact thing down the street, but people just weren't talking before. So I think where we don't provide direct service and we're not some people think some other groups are competition, where we're just trying to link people together, and we're all facing this. Drug use does not discriminate. Mental health does not discriminate. So we do a lot around stigma as well, and pushing that out through the coalitions. We work on a project called Breakthrough Stigma, which is a mural campaign that we just put up these big murals, and they have different taglines that say, "You're not in this alone." Breakthrough, stigma with love or community, and so I think that's one of the great things we can do is connect people. And like you said, this drug's popping up all over throughout West Virginia, so we know it's here, but just getting the word out on all these different programs and what's coming down the pike is what we like to do.
And so speaking of newer programs, and I didn't give you a heads up about this one, but I know you're very well versed in it, and a lot of people may not realize it's even happening, is the Recovery High School, which was definitely needed and will be such a great resource, I think, for kids here. Can you talk a little bit about that?
Yes, so we have been working in conjunction with the state, and I'm doing that as a volunteer. So I'm like, we definitely need to get some funding to help solidify this. But Bridge to Hope Academy, it will be out there for 9th through 12th graders who are in recovery. It's going to be a community bridge in the St. Albans area. So we did it a little bit backwards than most groups, because most groups really struggle to find a location, and this is just an example of a very strong partner that Community Bridge says, what do you need? We said a location, they said it's done. So it'll be a homeschool model, a micro school. So we're hoping to open in the fall. All the partners are in place. It's just a matter of securing funding to have a director and a learning coach. But I think that we have a really good thing going, and there's about 50 throughout the U.S. and they've been very successful. So we have some irons in the fire here, and hopefully some of those grants will come through and be able to offer that program, in the fall. They will graduate just like a normal high school, but the focus will be their recovery. So I think that's what we set kids up a lot because we send them out for treatment, and then once they finish treatment, they come right back into their normal high school, normal environment. So this will really be, recovery first, and then your education second. We'll certainly work with them and get them through where they can graduate from Bridge to Hope Academy, but that recovery piece is very, very important.
Which is huge, because if you come back into the same environment that you were struggling in, all of that hard work, they may lose all that progress they made. So
Absolutely.
having other kids around them too that are in recovery, I think will be a great resource.
Absolutely.
And you talked a lot about Kanawha Communities That Care and how it started so long ago, which does seem crazy that it was so long ago. But how have you seen the membership grow and just the focus and the work they've been able to do grow over the years?
I think one of the things we have seen is that a lot of support comes when you have a lot of funding. I think that's one thing that we learned. You can have a great system in place, but if there's no one there on a daily basis to continue to reach out to those partners, it kind of falls by the wayside. Mm-hmm. So we are rebuilding and letting people know we're still there, we're still doing the great work, but we just don't have a lot of the funding behind us. So we're looking for other opportunities. I think that it can be strong again. I think before it was probably one of the strongest in the state, mm-hmm. and now where we're getting our feet under us again, it's going to take some time to rebuild that.
Yeah, and I've seen the membership start to increase, and having a director in place I think has helped a lot too. Mm-hmm. We're going to take a short break, and then we'll be back to continue talking with Tina from Great Rivers and Kanawha Communities That Care.
Hey, Grandma Peg, what you doing?
Oh, hi, Rex. Well, you remember little Maddie, right? My granddaughter? She's on her way over to spend the afternoon with me.
What about these medicine bottles and pills, Grandma Peg? Those could be really dangerous with sweet little Maddie around. You remember what to do, right?
Oh, of course I do, Rex. I was just getting ready to put these away.
Folks, we never mess around when it comes to medicine. All medication should be kept in a safe cabinet or a high shelf, out of reach of children. Don't keep old Rex around.
Research indicates that the majority of students misusing prescription stimulants as study aids earn lower grades. Here's the good news. 81% of college students do not misuse prescription medication as study aids. Staying current with class material, prioritizing tasks, and accessing tutoring and online tutorials are just some of the ways you can stay stimulant-free. And remember, never share your prescription medications. Need some advice for how to do this? Visit wvdii.org.
Hi everyone, and welcome back to another episode of Healing Our Communities. I'm still speaking today with Tina Ramirez, who's the director of the Great Rivers Regional System for Addiction Care and also an officer with the Kanawha Communities That Care Coalition. So Tina, now that we've talked a little bit about the work that Great Rivers does and the work that the coalition does, I just want to talk a little bit about you and your work and your involvement in those. So I know that you've worked in this field for a while now, and I'm sure that that's helped in the roles that you hold today. Can you talk a little bit about how your past experiences or past jobs have helped really inform that work that you're doing now?
Absolutely. So I have been doing public health since right out of college, WVU, and it's very interesting how things have changed. And everyone, if you're in a room with 10 people and you ask how many of you know somebody or have someone who, in your family that's experienced, substance use or overdose, every single one of us is going to raise our hands. Mm-hmm. So we're not, the minority. Our families experienced it as well. And running the harm reduction program there at Kanawha Charleston Health Department, I think really solidified what I wanted to do in a career. Just seeing those folks that come in and at their worst, nobody when they're a kid when asked when they want what they're going to do when they want to grow up, nobody says I want to be addicted to heroin or
Right,
methamphetamine. So working with those people who are involved in the program and seeing them come to life, you may be the only one that talked to them that day, and connecting them to services and treating them like a human, because they're just like us. They just have this monkey on their back that they have to deal with every single day. So being able to, hopefully get them into some form of treatment, but in the meantime, providing that wound care for them, linking them into a food bank, someone who's going to help with insurance, and really, helping people and not make them feel like the modern day lepers. I heard that so many times, and even within our system that we have, with our first responders and community members and church, and when you do these surveys, some of us talk a good game, but then when it comes down to it, like we were in Cabell County not too long ago, and they did a survey of providers. So take care of these folks every day, do everything, but the stigma was still there when you ask, would you let them rent a room in your house? Would you let them keep your kids, So that continues to motivate me. Like, we have a lot of work to do. We have done so much to help people and their families and their kids, but we have a lot of work to get over that stigma. But people in recovery, and we deal with them every single day, are the strongest people that I've ever met.
Yes, absolutely.
So no longer do you say those people, we're all together. And people have a stereotype of what they think someone who's suffering from addiction looks like. They could be sitting next to us. They're running companies. They're leading, organizations. So, we had a lady that went through our harm reduction program, our syringe service program, and I saw her at another meeting on the street one day. We were doing an outreach, and she was thanking us. And I would have never guessed it was her. I was like, wow. So it really, you think about all the people that you reach out to, and if you just help one person or one family connect to services, that's what keeps us going. And some days you're just like, I don't know what we're doing. We're just chasing our tails. But it really makes a difference to stay in front of these people and offer them services. So that's what motivates our business here.
Yeah, I'm glad you mentioned that, because we actually were having this conversation in the office this morning. I was talking to a coworker, and she said, people just want to be treated with a little bit of respect and have their dignity. And she's like, that's it. People just want to be treated like everyone else. And I was like, absolutely, that's so true. You have a substance use disorder that makes you no different from someone struggling with cardiac issues or whatever the case may be. People just want to be treated nicely. And so I love that you mentioned that. In this work, and maybe not even necessarily just in the role you're in now, but in past roles as well, I have a couple questions for you. What do you think has surprised you most about the work that you do?
I think one of the things is that, people want to help. They really do. The churches want to help. Community wants to help, but they're not sure how. But what we've seen a lot is that families really trust their church congregations. So, but if you come to your priest or your pastor or your rabbi, are they ready to take on this load? Wow,
Right.
So I think that's one thing that was surprising, is that our faith-based communities want to help, but how can we do that? So I think continuing to keep them at the table, as well as EMS and law enforcement and first, all the people that are there, because we can talk about this, but I can't speak from a first responder's, point of view. I can tell you what we're doing quick response team wise, but if I'm a first responder that has been at a house multiple times over one weekend, it's hard for me to say, just give them a hug and love them.
Right.
They see a different view. So I think providing support for people, from the time if they do have EMS come, have a peer recovery support specialist, someone with lived experience there, to walk them through the system and hope, that they get linked to treatment. Same thing with our reentry population. That's another group that, has been hit so hard because so much of the focus has been on substance use disorder and families, but not that reentry population. So people, coming out of incarceration that may have a substance use disorder, may not. So I think learning from everyone and going in and really listening to these different groups and not preaching to them, but talk with them. How can we help you? Versus saying, here's a piece of paper with all of our outlines.
Right.
This is how it's
Good
going to be for every county. Yeah, here's a number to call on Monday. So I think that's been a learning experience. And like we spoke earlier, just the stigma that's out there, continuing to talk about it, making it, just like when we talk about the Narcan, having it in your first aid kit. why wouldn't you have it there? Or talking to people and say you're not alone. There's a lot of support out there, and really just trying to make sure everybody's on the same page, that there's hotlines out there. There's people you can talk to. There's just so many services available, and how we can get the word out. That's one of the things I think we still need to work on.
Yeah, absolutely. And so, any disappointments in your work?
I think, like we had, talked about the modern day lepers, just people who have it in their mind, like, I'm not going to give them Narcan, or I've already given them Narcan 3 times. So, but you have to think that's somebody's family. So the only, requirement for someone to get help is to be alive. So why wouldn't you?
Right.
Why wouldn't you give that to them? But it's in everybody's mind. Like, we hear that so many times. Like, I've done all I can, and I'm not going to give it to them, or I might give it to, if I have a pet and they get something, I would give it to them, but not my son or daughter. And so that really surprises me, that people just they're at their last rope, and so that is still hard to overcome, and hear somebody say, well, I wouldn't give that to them. Or, right. And I know you've seen it too, when we set up a Narcan event, an outreach, and somebody just comes and starts driving you crazy about, the cost of Narcan, and why isn't, for instance, the other medications like insulin readily available. And we're like, why can't you fight for both? This one is not driving the other, right? Yeah, so that's disappointing sometimes. But I mean, just being out there, and I always tell our team, go for the champions. Knock on that door, and if they don't want it, thank them and move on. Because there's somebody out there that will want it. So.
Absolutely. So what is it about your role, or just maybe working in this substance use disorder prevention, treatment, kind of like you said, the whole continuum of care field in general, that inspires you and keeps you optimistic for the future? Because it can be a tough field to work in. There's a lot of burnout, and it can be disheartening. So what keeps you going?
Yeah, there is a lot of compassion fatigue, and I think just hearing those stories of success and being able to talk about, prevention, intervention, treatment, and recovery, and not just being like stuck in, behind a desk all day, every day, just hearing the same things, and providing that support for the families and, the kids. And I think we have a great system. If somebody says, I want to go to treatment today, where do you want to go? I think it's really neat to be able to link them in, or, I need food, where can I go? Oh, well, the quick response team can bring a box of food to you. I don't have transportation, So finding all of those champions in the community, and really saying, we don't have to do it all. Somebody in your community is already doing it, or if not, how can we get that started in your community? Yeah. And I think Kanawha County is a prime example. There's so many great things going on. Some of the smaller counties like Jackson and Mason don't have the access, just like we were talking about transportation-wise, or all the services that we have. So how can we kind of be that big brother to help them get something established, or be able to link them to services? So.
Yeah, agreed. What do you enjoy most about your work at Great Rivers and with the Coalition? Because they are similar but different also.
Yeah, I really enjoy having the Marshall Health System behind Great Rivers, and I get asked all the time, how do you get like the hospitals to talk to each other? How do you get these people to sit at the table? And so I like being able to just go in and say, look, we don't have all the answers, but if you want a sample of what one of the hospitals is doing, they're able to provide that to you. And with this coalition, it's the same thing. Learning from the other coalitions in the area, talking about what's working in Kanawha County, or trying something that another county might have done and then not working, and being able to go back and say, why didn't it work? Let's regroup. And I think we have a lot of outlying, areas to Kanawha County. So, we have a lot of stuff right in, this little area here in Kanawha County and within the city, Charleston. But then when you talk about, Eastern Kanawha or Sissonville or Clendenin, where I'm from, those services just kind of start to, disappear. So I think we do a great job talking to community members, but it's really just being able sometimes to just take it to them. They're not always going to be able to come to Charleston. Right. And some people, honestly, I swear, don't ever leave the area that we're in.
Yeah, I agree.
Everything's right there. So to come to Charleston to do an event is really tough. Yeah. So taking it to them is a big lesson learned.
Yeah, I think meeting people where they are is always kind of the way to go for some communities. Like you said, I know where I lived out in Sissonville, there was no way you were going to get people 45 minutes away to want to come to Charleston for something. Any events or activities coming up, either coalition related, Great Rivers, that you would like to share with our viewers?
Yeah, so a couple of things. One is Monday, and you can check our Facebook page, but there's a screening, a reentry screening at the LaBelle Theater. I forget what it's called. Something. Anyway, but it's, I forgot the name of it, but that's something that's immediately coming up at 6 o'clock on June 3rd, and then Save a Life Day, of course, is September 26th. So we are continuing to have planning around that. Anyone who wants to get involved with the Narcan distribution, and this year it's all the Appalachian states. So that's going to be really cool to be able to expand that. But any events that we have, I know we have Lego nights that go on with Communities That Care. We have an event June 1st with Mountains of Hope, which is going to be like a fishing, hiking kind of thing there at Kanawha State Forest. But all of those are listed on Communities That Care and on Great Rivers. So anyone that wants to look at the events that are coming up, and I try to post those out every single time they come across my desk. So I feel like almost daily things are coming across there.
Yeah, there's always something going on. Can you share when the coalition meets, and if people live in Kanawha County and they want to get involved with the coalition, what can they do?
Yeah, so follow us on Facebook. We're doing something a little bit different in the summer months. The coalition decided they wanted to go visit different community partners, such as Community Bridge, to learn what they're doing. So I know that we are looking at dates for that. So it's usually the third Friday, I believe, or something like that, second Friday. But you can look for the dates. I know that they've switched some things up for the summer months. But yeah, just get on there, and like I said, we're going to start with Community Bridge, I believe. We have several different places that we're going to go, and then hopefully recruit some more community members to be part of the coalition, and then we'll decide on a space where we want to have it. We tried so many different days of the week and the month and different locations, and we just haven't really found what's going to work best for everybody.
Great. Yes, everyone can check out Facebook, both Facebooks, and see how to really get involved. Anything else you'd like to share with our viewers before we go today?
I just think that focusing on the positive stories that are going on, you know, we work with media outlets all the time, and a lot of it's the negative side of it, but we have a huge amount of successful things going on throughout the state, especially here in Kanawha County with the resources and everything. So if you need anything, there's, Help for WV. There's a lot of online things you can work at. You don't have to always be in person and go some, way out of your community to connect to services. A lot of healthy alternatives that don't cost anything in this area. So I think just getting involved, however, whether you're part of a business or faith-based community or first responders, there's always something that we can do. Everybody plays a role in overcoming all this stigma and all the substance use disorder. Well,
thank you so much again for being here today. It was great getting to catch up and talk about all the great work that's being done. I really appreciate it. And thank you to our viewers for tuning in. We'll see you next time on another episode of Healing Our Communities.